Number one, we're looking for new, better antimicrobial agents. There have been two antimicrobial agents that have been approved over the last year and a half that are going to be able to target some of these multi-drug resistant mechanisms for Pseudomonas and other gram-negatives. So that's very helpful. We're also looking at ways to reduce the virulence of these organisms and perhaps modify the host response that would benefit the patient and reduce some of the burden of the disease. As we know, much of the manifestations of infection are due to the host's response to the microorganisms, and as they respond, they can produce what we call cytokines. But the purpose is to destroy the microbe. On the other hand, however, these cytokines can also cause harm to normal tissues, and we refer to that as multiple organ dysfunction. And if that occurs, that can be very detrimental to the host, to the patient. So if there's some way that we could maintain the good antimicrobial effect of an antibiotic and at the same time reduce the host effect so it doesn't cause further damage to the patient, that's going to be a benefit. Well, we know as we continue to use antibiotics, there's going to be increasing mechanism of resistance, and one of the new mechanisms that was identified this year is referred to the MCR1 gene. This is a gene that's on a plasmid that can be transferred from one bacteria to another, but the important thing is that it confers resistance to one of our last drugs available, and that's colistin, and so that's going to be a significant concern. So again, it's a message that when we use antibiotics, we have to use them judiciously, very appropriately, not overuse them, because that is the most significant reason why antimicrobial resistance occurs. That is the overuse of antibiotics. There's many studies to show that even in the hospital setting, 50% of the use of antibiotics is unnecessary. And so that is a big message as far as antimicrobial stewardship. There is a guideline that was published earlier this year on antimicrobial stewardship in hospitals, which outlines some of the principles that I've mentioned. But as I would review those, I would say, number one, it's important to evaluate to make sure that an antimicrobial agent is warranted, number one, that if it is warranted, we should use the right drug, the right dose, for the right duration. And if we follow those principles, then I think we're going to maintain the use of the antibiotics for a longer period of time.